My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to DO or Do Not. If you're interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
My name is Mason D'Amelio, and I'm a first-year medical student at the Alabama College of Osteopathic Medicine, and you are listening to DO or Do Not. In today's episode, we're thrilled to have Dr. Bill Admire, a physician whose dedication to both community and professional leadership is truly inspiring. Dr. Admire holds many titles, including Vice President and Chief Medical Officer of the Infirmary Health System in Alabama. He also serves as a core site medical director for the Alabama College of Osteopathic Medicine and is a board member of the Medical Association of the State of Alabama. Dr. Admire has recently taken on the role as the designated institutional official for the Mobile Infirmary Graduate Medical Education Program's internal medicine residency, further extending his impact on the next generation of medical professionals. He discusses his philosophy on the importance of leadership and volunteerism in medicine. In today's interview, Dr. Admire shares with us lessons he has learned and his experiences starting as a practicing physician, moving to entrepreneurship by starting and growing a large medical group, and maturing into a role as a leader and educator over his 30-year career. Dr. Admire will share his personal philosophy on medicine and the importance of leadership and volunteerism. We know you will love this episode.
Hello, you are listening to DO or Do Not. My name is Hadia Tariq. I am a third-year medical student at ACOM, and today joining me we have Dr. Bill Admire. Dr. Admire serves as the Vice President and Chief Medical Officer of Mobile Infirmary Health System in Mobile, Alabama. In addition to his many other titles, he is also a core site medical director for ACOM in the Southeast region, and he is also the designated institutional official for Mobile Infirmary GME. Thank you for joining us and welcome to the show.
Good morning, Hadia. Glad to be here.
We're glad to have you. Okay, so jumping right into our first question, when and how did you become interested in medicine and decide you wanted to be a physician?
I've been asked that question so many times through my medical career, which now is 34 years since I graduated from medical school. I look back to my younger days when I lived in a small rural town in Danville, Pennsylvania, maybe a population of 10,000 people that had a huge hospital system called Geisinger. And a lot of my friends in middle school and high school were children of physicians that worked at the big hospital. So I had a lot of exposure to physicians, not only at the hospital, but also in the community. And I was always impressed on how professional they were, how they cared about the community. So to me, it was a inspiration and motivation. I'd like to be a doctor to care for people and help people out. And that's so important for young doctors to feel that way.
Where did you go for undergraduate school, and were there any experiences there that led you into medicine and specifically osteopathic medical school?
I went to Susquehanna University, which is a small liberal arts college in Selinsgrove, Pennsylvania, around 500 students per class. So we're talking only 2,000 students. So it's a small college, but very prestigious. It's a private school, great liberal arts, and very good science program too. They do produce a bunch of students that go out into medical school, dental school, veterinarian school, and such. So I feel like I was well prepared at Susquehanna. And while I was there, I would do externships with physicians, and I actually did one up with the dentist also. And I soon realized that dentist would not be my profession, but medical field was very intriguing because I rounded with an osteopathic physician, Dr. David Revac in Bloomsburg, Pennsylvania. I spent a month doing an externship, following him and shadowing him. And he's a DO, doctor of osteopathy, and he was family medicine, and he also did OB. So for 30 days, I don't think I slept or anything. I just kept getting up early in the morning and going to work and coming late at night. And even though I put tremendous amount of hours and saw things day and night, I took call with him also. It really influenced me that I would love to be a doctor. And I love the way he, as an osteopathic physician, took that holistic approach to patient care. He also did OMT, osteopathic manipulative therapy, hands-on treatment. kind of like a physical therapist does with his patients, along with being that holistic doctor looking at their whole body systems rather than just a specific specialty. And he really connected to his patients. And that was inspiring, and that motivated me more, so that when I applied to medical school while I was in undergraduate college, I applied to Philadelphia College of Osteopathic Medicine and was accepted. And that started my journey.
That's definitely a very relatable story when it comes to pursuing medicine as a career. I think many of us find physicians in our community that we look up to and that inspires us to follow in their footsteps. So how was your experience like at PCOM? And then how did you later on choose your specialty?
At Philadelphia College of Osteopathic Medicine, 210 students per class. That may be larger now because that was 34 years ago. But it was challenging, a lot of hard work, a lot of time spent the first 2 years in your didactic classes. But you really team up with your friends and you build relationships and you support each other, because all you're doing is going to class for 8 hours a day, maybe take a quick hour for dinner, maybe go to the gym for 30 minutes, and then go to the library and study until midnight and get up the next morning at 6 and do it again. And of course, all the tests are on Mondays and Tuesdays. And they do that on purpose so that we're not out partying on the weekends, because they know we're going to be studying all weekend, Friday, Saturday, Sunday for the tests on Monday and Tuesday, which was, I think, was a smart thing. We didn't know why they were doing that, but now I understand. The first 2 years, I did very well didactically and good ranking in the class. Started my clinicals the third and fourth year, where you leave the classroom and you go out to hospitals and do rotations in all the various subspecialties of medicine and surgery. And it was there that I think I changed my mind 10 times on what kind of doctor I was going to be, because everything I did, I liked. So every month the joke was, what's Dr. Admire going to be this month? And that's how it worked out. And I ended up, after 4 years, I did an osteopathic internship at Delaware Valley Medical Center. That's another year of exposure to medicine, pediatrics, OBGYN, ER, surgery, and such. And then after that, I did 3 more years of training postdoctorate at Geisinger Medical Center. It's a huge hospital in central PA. And there I did internal medicine, finished my 3 years of internal medicine at Geisinger. And I owed the government 2 years of public health service. They helped pay for 2 years of my medical school, and they gave me a stipend to live on. And there's a reason behind that. I'd love to tell you, is because I'm one of 5 children with one parent family, and my mother worked 2 jobs. I was the second oldest of the 5. I was the oldest male. And my sister and I, Roxanne, we took it upon ourselves we took care of our 3 younger siblings, and we worked hard in school. We didn't have much. I would say we were poor. Didn't feel like we were poor, but we were. Now I look back. But we were happy. We were a family, and we all worked hard and all had successful careers. And because of that, I had a lot of hunger to do well and support my family. That made me work hard to go to college. I was an athlete along with being a good scholar. And I went on a track and field scholarship and academic for 4 years. And then I went to medical school with no money at all, took out loans for 1 year. I received a merit scholarship my second year, and then I did public health for the final 2 years. And that allowed me to not be in so much debt. So I did a year of internship at Delaware Valley, 3 more years of internal medicine at Geisinger, and then I went to public health service, and I ended up coming to Mobile, Alabama, and worked at a federally qualified health center, which was Franklin Memorial Clinic, and had 2 years that I served back to the community and to the government for paying part of my education. And that really set the tone, because I would work extra on the weekends in emergency rooms, because I was trained as an internist, but had a lot of experience through the 4 years of training, especially at Geisinger, because they had a shock trauma unit. So I got to deal with a lot of trauma and really bad cases that come through the ER and admitted to the hospital, which suited me well to be an emergency room physician. And so I started my emergency room group at that time. And over 20 years, I started an emergency group called Mobile Emergency Group, had 100 doctors working for me. And then that merged with Team Health out of Tennessee. And also had another company I started, which was called Baldwin Physician Services. And we staffed urgent cares, nursing homes, occupational clinics, and physician advisor roles for various hospitals. And I merged that company with another company out of Los Angeles called IPC. So that was the entrepreneurial side of me. But my heart was always in healthcare, taking care of patients. And I think even though there was a little bit of entrepreneurship It was always, everything I did was based on patient care. It was centered around patients, being patient-centric with quality, safety, and customer services, which I teach all my medical students and residents to this day.
How did you find that transition from internal medicine to emergency medicine? Did you like both, or did you find yourself gravitating towards emergency more?
I always stayed with, my foundation was internal medicine, along with that osteopathic internship, which is the whole gamut of healthcare, of all the specialties in surgery and medicine. I felt like it was an easy transition for me because of my training at such a good place. And I credit all my ability to be a good physician to the people that trained me. And that's very, very important. And they taught me the nuances of being a good doctor, how to avoid pitfalls. And they gave me pearls every day to do the right thing. And they taught me bedside manner. They taught me about that doctor-patient relationship, which I can't stress enough. That's why when I go into a room, I introduce myself, I smile, I tell the patient who I am. And if there's anyone else in the room, I look at them, shake their hand, and to thank them for being there, supporting the patient. And then I take a seat right beside the patient. I get to their eye level and I talk to them and I listen. If you ask me what the most important thing, being a medical student, transitioning to a resident, and then off to be an attending physician, is you have to have that art of medicine, which is being able to connect to the patient and have empathy and be a good listener and show respect at all times. And give that perception of competency and that perception of professionalism. That means your body language, how you dress, how you talk, how you address the patient at all times. And they say, wow, that is a doctor. And then the third thing I really stress to everyone I teach in that now with students and medical residents is share information. Sit down and give them all the information that you have. Tell them your treatment plan. Answer any questions they have. Tell them how to get a hold of you if they have any questions or worry. And when you leave and you walk out of that room, that patient says, yes, I like that doctor because that doctor connected with me. They care about me and they show that compassion. So these are very important things for anybody that wants to be involved in healthcare, not only being a doctor, but a nurse or a physical therapist or a respiratory therapist or any other ancillary help that's in a hospital, even a phlebotomy that draws your blood. They must connect with the patient and show them all those things that are so important.
I also did want to ask you, you mentioned growing up in Pennsylvania and then making that shift down to Alabama, specifically Mobile. How was that transition for you?
I came down in the summer of 1993, and I almost got in the car and drove back to Pennsylvania. It was so hot. The humidity and the heat, but you get acclimated to that, and it's wonderful. I love the South. I love the North. I go back and forth all the time because my family's still in Pennsylvania. There is definitely a Southern hospitality. The people, demeanor of our folks down here is just wonderful, and the same up north. The accents are a little different, but I think the hospital and the healthcare is very similar. The standard of care, best practices, evidence-based medicine, we do the same. You shouldn't practice medicine any different in one area of the country compared to another. So the transition was good. The weather was the biggest thing for me, but the people I love the Northerners and the Southerners. It's no problem whatsoever. And the quest to give the best healthcare is always important.
You wear numerous hats, from being a board member to the Medical Association of Alabama to being both the CMO and the VP of Infirmary Health System. How did you decide to pursue a more leadership-driven role in medicine, and how was that transition for you?
Leadership in healthcare is so important. And I don't think it has to be just administrators that lead. It needs to be physician-led also, along with nursing-led. So to me, it's a tripod. It's physician leadership, administrative leadership, and nursing leadership, because those are the folks that have to control a hospital and the care that's delivered. And you need input from all three. So any hospital that I see that does not have physicians on the board or nursing on the board, to me, that's a red flag, because everybody has very important information. So the transition for me was, I came out, my emphasis was on clinical care. And I was the medical director right from the get-go from all the positions I had. And over 20 some years of practicing, I was elected to be chairman of medicine, chairman of critical care. I was the department chairman for emergency medicine. And these are all leadership roles. So you have a duty to be a leader, to lead by example, and to teach the other doctors or inform them at all times of what is going on in the hospital setting and the clinic setting and what the needs are. And we follow metrics very closely in hospitals, like infection rates or mortality rates, HCAP scores, which we want to see what the patients think about us when they leave the hospital. And you take these metrics, which is data, and you give it back to your physicians. And you say, all right, well, how can we make improvements on this? How can we make our metrics so that we are a very good rated hospital? And that's all what I believe in and how I was trained. So that was smooth. And being leadership, that's just your style of practice. Some people want nothing to do with leadership. And that's understandable. They just want to practice medicine, go home, be with their families, and live their life. Some people really want to be involved in day-to-day activities and leading and make succession planning and other things, and also change protocols, algorithms, clinical pathways, order sets. And that's extra work. And I gravitated towards that. So I was medical director, and then I became president of the medical staff when I was in my mid-40s. I sat on the medical executive committee and all the other committees that I led over time. I was also volunteered as a police officer for 27 years now with the Mobile Police. We have 9, we call them police surgeons in town that do that. I've really loved doing that as a volunteer. What I do is take call, and if a SWAT team or any type of event is going on in town, they need a doctor to be with the police officers. I will ride with the captain or the chief. If an officer's down or anyone, if there's an incident that someone goes down, I'm there to help them en route to the ER. So that, to me, that's a volunteerism, and I love doing that too. So the transition, I would look at my career now. I'm in my second career. So my first 25 years were clinical, being a medical director, heavily involved in patient care, both in the emergency room and internal medicine, nursing homes, places like that. And then the next role is, after being chief of staff, they asked me to become a vice president and chief medical officer of the Mobile Infirmary and North Baldwin Infirmary, and also our long-term acute care hospital. It's 3 of our 4 hospitals in our Infirmary Health System. And I said yes, of course. And here I am 12 years later, still being a member that's working hard of the medical staff. I'm an active member of the medical staff, plus I'm an administrator, and I'm still a physician, and work closely with all those 3 entities I mentioned before: administration, the medical staff of physicians, along with the nurse practitioners and physician assistants and certified registered nurse anesthetists and anesthesia assistants, which we call advanced practitioners, those 4 entities, along with physicians. So I lead them, and I work closely with nursing, because you can't have good doctoring without good nursing, and vice versa. So we have a CMO, which is a chief medical officer, vice president, that's me, along with Ursula Lawrence, who's the chief nursing officer and vice president. And we form a dyad so that whatever I'm doing with the medical staff, she's there. She's aware of everything. I invite her to all the medical staff committees so that she's aware of what doctors are doing, so she can take it back and tell the nurses. And I go to her nursing staff meetings, so I know what she's doing with policies for the nurses, how they take care of patients, so I can inform our physicians in our hospital. And that dyad has proven very successful over the last 7 years that Ursula's been here with me working.
I like that concept of a dyad. I think in medical school, we are taught about the importance of being a leader in your team, but also how interdisciplinary medicine is and how important it is to respect every person within any healthcare team to best care for your patients. And so I think that's a really good example of that. How has being one of the few DO physicians in certain leadership roles and spaces influenced your perspective on being a DO?
I'm very proud of being a DO, a doctor of osteopathy. It is the same training as the allopathic or MDs. We go to college for 4 years, then we go into medical school for 4 years, then we'll go off and do a residency anywhere from 3 to 7 years, and that includes residencies or fellowships. The osteopathic profession now, 25% of all medical school graduates in the United States are DOs, osteopaths. That's incredible. Now, go back 35 years ago when I graduated from Philadelphia College of Osteopathic Medicine. When I did my residency, I was maybe 2 of 400 residents that were DOs. So I was definitely a minority and maybe looked at a little different. And if you had an inferiority complex or were worried or you wouldn't feel comfortable, I felt comfortable. I knew I was trained well, and I jumped right in there with my allopathic comrades and we did well together, and you earn the respect. So then when I finished my residency and moved to Alabama for public health service, when I came down here, there were even less DOs in Alabama at that time. But I started working and I just worked hard, did a very good job, and made sure I did that by, I'd always know when to consult or refer or make contact with others for advice. And you earn respect. And the next thing you know, I'm the medical director of the largest ER in our metropolitan area. And I expanded that to 8 or 9 other contracts around the region. And I started another company with nursing homes and urgent cares and occupational clinics, and always kept quality and safety at the utmost concern. That was the purpose. So you build a reputation, but you actually set an example. And I had a good knack of hiring the right people, and I was a good recruiter. I could go out so since I owned the company and I had a lot at stake, I really made sure I hired high quality physicians. And then slowly over the years, more and more DOs came into Alabama practicing. I'd hire them along with the MDs. Everyone got along. They realized the level of care was the same. And so being a DO, and then I became the first DO ever to be the president of medical staff at the infirmary, which is 110 years old. And I thought I was very proud of that. And I really worked hard on hiring diversity and equity inclusivity probably 25 years ago, when no one even talked about that acronym. I was already practicing that. So the doctors I hired it was eclectic, and they were wonderful people, and they did a great job, and they cared about the patients. So that was the reason for the success that we had as emergency doctors and internal medicine doctors. So being an osteopath, very proud of. I see no difference. We all take the same boards now. It's just called a single pathway. And I think the future is bright for both MDs and DOs going forward.
As a current DO medical student, I think that my class and the classes in my generation are very grateful for your generation for paving the way for us. It wasn't an easy task back then to be a minority in the medical space. And so I think we're very grateful for that. Shifting gears a little bit, I wanted to ask about your experience as a media correspondent during the COVID-19 pandemic. Was it something that made you think about your role as a physician differently and your role to the community?
When COVID came to the United States in 2020 and hit us like a storm, and we didn't know what was going on. I'm sorry, the healthcare, we were turned upside down. People were becoming very sick. People were dying at high numbers in different areas of the country as the virus swept across the country and the world. So what do you do? Panic can strike the communities, the public. And I was called upon by the mayor and other leaders in the community to be a spokesman throughout the week, to go down and meet with the mayor and do press conferences. And the main thing was to educate the people what was going on, what they should do about COVID, how to be safe. And I think this was very, very important, because I'd get up with my white coat on in front of the public on TV, along with my other partners. And we had 4 chief medical officers in Mobile, one from Spring Hill, one from USA Medical Center, one from Providence, and Mobile Infirmary. And we would take turns talking to the public, along with the other public leaders, about COVID, reassuring them that we're going to get through this. Stay calm. I know there were a lot of closings of schools and businesses and wearing masks and social distancing. And we encouraged that. And as we waited for a vaccine to be developed, and that came, we encouraged that. Because at the hospital here at the infirmary, we have 684 licensed beds. We closed our entire 4th floor. And at the peak of our inpatient census during COVID, we had 220 COVID patients. And a lot of them were dying in the intensive care units on ventilators. And it was tragic to see that happen, that we wouldn't let visitors come into the hospital to see their loved ones. They would use FaceTime on their phones or iPads. And it just broke my heart. So the more I could get out there and speak to the public, whether it be on TV or on the radio, national broadcasting systems, I did whatever I could. And I would keep up on everything that was going on with COVID, so that I would give the latest information, accurate information, even though some of it was controversial. And as we know now, we're looking back, we of course, 2020 or Monday morning quarterback, you always say we could have done better. Of course we could have, but no one knew what was going on with COVID. And finally, we got the vaccine, and over a 3-year period of almost 4 years, COVID, it waned and waxed downward. And here we are today, still COVID, but we're doing much better with it. So it matured me in the fact that the frailty of healthcare, having a pandemic hit, what do you do? And you have to be very prudent and responsible as a spokesperson for the community to tell them what needs to be done. We followed CDC guidelines, and we listened to all the physicians on TV that were talking, and we give that information out to them just to try to do something to help the community. It's all about population health management and showing that compassion and caring and delivering the message, and hopefully that people respect physicians and other healthcare workers enough to listen to the advice and do the right thing. So it was a very strenuous time as far as time in the hospital and doing all the other things I did, but I'm glad I do it, and I do it over in a heartbeat.
And switching gears again, now I wanted to ask you about your role in medical education. So specifically, how long have you served as the core site medical director for the Alabama College of Osteopathic Medicine? And have you developed a philosophy on teaching and mentoring students over the years?
Yes, and it's become a new passion of mine. Before I was all clinical and entrepreneurial, and then administration, and now I'm in the education world with graduate medical education. But it all started when Alabama College of Osteopathic Medicine back in 2010 came to me and talked about their plans to open up the medical school in Dothan, Alabama. And they knew I was a DO, so I'm sure they gravitated to me because of that. And I said, absolutely, I'll help whatever you need. So I've been doing a core site medical director for 3 hospitals: Mobile Infirmary, North Baldwin Infirmary, and Thomas Hospital Infirmary. I'm the core site director for students during their 3rd and 4th years. They come and I do journal clubs with them, keep in close contact. I have a coordinator named Carrie and another one named Anna that help me with the students doing their scheduling and handling any problems that students may have, as you would imagine, when they're 3rd and 4th year, because they're like our children. But I stress upon the students the things that you and I talked about earlier: quality, safety, customer service, how to make yourself a better person and a better doctor by being a good listener, by caring for your patients, not being in a hurry, sitting down with them, being thorough, don't take shortcuts, and learning, constant learning daily. There should never be a day when you're a medical student or a resident or an attending that you're not reading and making yourself better as a physician with all the information coming out these days. The good thing now is medicine, you have access to iPhones, computers, laptops. You can get information in a heartbeat. 35 years ago, we used to carry little books in our white jacket and carry them around with us to look things up, or run to the library and find a journal that you wanted taking care of a patient, or having a textbook close by. So it's much easier now to get information. That's actually sometimes information overload. So my job with students is to reassure them that they're going to do well, tell them that's not going to be easy, be real with them, expect them to have great work ethic, put the time in, and really care about being a physician, part of the noble profession of medicine, which is you serve the community. Doctors make good money, no doubt. We don't make as much as entertainers and professional athletes, things like that, but we do well. So don't worry about the money. Worry about how are you practicing medicine to improve patients' lives that are ill or dying. Can you make a difference? And to serve. So my whole thing about education is competency, customer service, great attitude, and respecting the medical profession for what it is. Telling the students and residents that they represent not only themselves as a doctor, but they represent their family, their medical school, and the profession. So it's very, very important that they're rule followers, they understand evidence-based medicine, and they understand customer service, and don't put themselves before the patients. Always the patient first and their families. So that's my philosophy on graduate medical education and teaching medical students.
As one of your students, I can personally attest to the value of the advice that you give. I'm definitely very appreciative of it. Can you tell us one thing about you that has made you successful, aka what is your superpower?
I'll go real personal in this. My father left when I was 5 years old and left my mother with 3 sons and 2 daughters. And that left us on I use that phrase, on the wrong side of the railroad tracks. We weren't in the upper echelon socioeconomic sector of the city, of the old town we lived in, but we didn't care. My mother taught us, she worked 2 jobs. She was hardworking and she motivated us, and she was a disciplinarian, and we all did very well, my siblings and I. So my superpower is the strength that I inherited and learned from my mother to be successful. And it's not all about you, Bill. It's about others around you, and to be humble and kind. But at the same time, be a disciplinarian and encourage and make students and residents and other doctors, attendings as a CMO, have to watch over the medical staff to be the best they can be. And that's cliche, but it's true. We should every day come out and put our A game on and do the best we can, because no matter what you do, whether good or bad, you're going to affect someone's life. So the superpower is the caring, the empathy, and the compassion that I carry every day to do the right thing for the patients.
That's great. I love that. Okay, so that leads me to the final question, which is, what is the best piece of advice you got throughout your career that you always think of and would like to pass on to our listeners?
I think I've gotten so much advice from so many people that anything I am today is a credit to the people that were around me, supported me, loved me, encouraged me to do better. And no one's perfect. And there's many times bumps in the road that I would get through and maybe wasn't doing as good as I should. And we all have that. It's because we're humans. If anybody says they don't, they're not telling the truth. So I guess that's trials and tribulations. But my advice was, be the best person you can be day by day. And when you wake up, have your goals set out, be organized and structured, be true, be ethical, be fair, and be kind and spread love around. As physicians, we don't use the word love enough, but I tell a lot of my docs, I love you. And they smile at me and they get surprised by that. But it's true. That's how I feel about others. And then even though sometimes I may be stern and focused and driven at that moment because I have a lot on my plate to handle as a vice president, chief medical officer, and DIO, and core site medical director, and a police officer, and sit on many different boards. My days are long, but they're always fruitful. They're rewarding. And I don't do it for me. I do it because that's what the profession needs. And I love helping other people. And that satisfaction I get from helping others is something that you'll take with you to the end. And so I would tell every young medical student now, be structured and organized, and know that you're in a noble profession of service, and be ethical at all times, and take care of others, and keep that humbleness about you. Don't get that God complex that some people talk about physicians having. We are nothing more than anyone else. It's a human with a white coat, and we're skilled in taking care of people that are sick, ill, and dying. And we worked hard to become proficient at that. And these are important things for them to know, that it takes hard work. We weren't born with this knowledge. It was given to us because we studied hard by our mentors. And use those words of encouragement and know that it's a long career and you're going to lose patients. But if you know that you did the right thing, it's important because you have to keep going. But that brings me to one other point. When you talk to patients for the new diagnosis, whether it be cancer or bad heart disease or lung disease, that you do it in such a soft manner and you take time, never act like you're hurried, and have that empathy and compassion. And you're going to have to hire more doctors because you'll be so busy. And that's the truth. If you build up your reputation and you give out that good quality medicine, you will be so busy that you'll have to go out and hire doctors to join your groups. That's success right there. Because people now have the choice. The customer can choose where they go for their health care. So it's important that all doctors understand that. And those are the words I have. Kindness. Don't ever forget the word kindness. Just be a kind person. Not only in the healthcare, but even outside of healthcare. Be kind to everyone. It goes a long way.
I think that is a great piece of advice to end this episode on. Thank you so much, Dr. Admire, for sharing your life and your journey with us. It has been a very inspiring conversation.
Adi, I can't thank you enough. You are a wonderful third-year medical student. I am so proud to have you as a medical student. You are going to have an illustrious career. And I'm just sad that you're going into psychiatry and not internal medicine, because I'd love to recruit you. But I'm sure we'll keep in contact.
Yes, definitely.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do or Do Not.